Okay, now we're going to cover another topic that will be covered on the exam, which is called emergency and safety. You'll have specific questions that will be drawn from this topic. You first want to talk about the frayed cord. You do not want to use equipment that have frayed cords. You need to remove any equipment that has a frayed cord from use. You want to tag it so that maintenance can come and fix that equipment. But you do not want to use frayed cords. They are a hazard. Falls. Residents, when a resident begins to fall, you do not want to break the resident's fall. You want to ease that resident to the floor. What's important is that you do not allow them to get up. You also want to notify the nurse that the resident has fallen, and you want to wait until the nurse comes to assess the resident before helping their resident to get up from a fall. Most facilities are no lift facilities, so you will have to use a mechanical lift in order to pick a person up from the fall. Remember, when you're using mechanical lift, there must be 2 CNAs present. You must make sure that the patient's weight does not exceed the weight maximum for the lift. You want to make sure that you're choosing the appropriate sling for the weight, for the resident's weight. So when a resident is falling, you want to make sure that you don't break the fall, you ease them to the floor, and you don't allow them to get up until the nurse has assessed them and given you the okay. If the resident is a bariatric patient and they begin to fall, and bariatric meaning that this patient weighs more than 500 pounds, you want to move things out of the way to prevent that person from hurting themselves in the process of a fall. There are some things that you can do to prevent a resident from falling just by answering call lights frequently, making sure that you have the call light within reach. Most residents fall in an attempt to try to get to the bathroom, so answering call lights quickly is going to be very important in the prevention of assisting a resident or keeping a resident from falling. You also want to respond to alarms quickly. You want to remove slip rugs or any objects that may be in the path that the resident generally walks in to prevent them from falling. You want to make sure when the resident is ambulating that they have on shoes with a rubber sole or non-slip bottom socks or shoes to help prevent them from falling. When a resident is in the shower, you want to make sure that there are grab bars for a resident that is taking a shower, and you always want to have a shower chair near, just in case the resident gets dizzy or they get weak. You can sit them down in the shower chair to help prevent them from falling. Residents generally fall in the bathroom or during shift change, especially during shift change when observation is not as keen as it would be during the shift. People are distracted where they're trying to give reports, and patients are known to fall more frequently during this time. But the bathroom and their actual bedroom, are the most frequent places that you can find that a resident will fall. Resident with sensory impairments like hearing impairment or blindness, this puts this resident at risk for falling. Now we're going to talk about choking. If a person is choking, the universal sign for choking is clutching the neck. The first thing you want to do as a CNA, if you see someone clutching their neck and they are not breathing and they're not speaking, you want to ask them, are you choking? And then once that person validates by nodding their head yes that they are choking, then you want to perform abdominal thrusts, or what we used to call the Heimlich maneuver. You want to give those abdominal thrusts if the person cannot speak or if they cannot breathe. You want to get behind them. You want to place your fist at the bottom of their stomach, and you want to cover that fist with the opposite hand. and push quickly upward at least 3 times, or until the object that is occluding the airway has been expelled. Once again, this is called the Heimlich maneuver or the abdominal thrust. If you are dealing with a person that is obese or a person that is pregnant, you want to take your arms and move them up to the chest, the breast or the chest area, and then you will perform your upward thrust in that area. You never want to perform upward thrust on a pregnant belly or with an obese person. In order to perform them correctly, you would need to, if you can't get your arms completely around the girth of the abdomen, you want to move your arms up to the chest and perform your now we're going to talk about choking. If a conscious resident has their hands around their throat and is making no sound, the first thing to do is ask, when a resident has an obstructed airway, they cannot breathe or speak. So next we're going to talk about cardiopulmonary resuscitation, which is a long word for CPR. You need to know the ratios for CPR is 30 chest compressions to 2 rescue breaths. And if you're working with a child and there is 2 rescuers present, those respirations are cut in half to 15 chest compressions with 2 breaths. And again, this is with 2 rescuers and a ambu bag in use. With CPR, you want to make sure that you're pushing at least 2 inches deeply into the chest, and making sure that you allow for the chest to fully recoil before pushing again. You're acting as a pacemaker for the heart, and you want to continue to do CPR until the EMS, someone from the emergency response system, arrive. If you get tired, then you can switch out with a family member or a friend. But remember, when we're doing cardiopulmonary resuscitation, we are doing CPR and we're pushing in the center of their chest at the lower part of the breastbone, 30 chest compressions, and then we're giving them 2 rescue breaths. Also, with CPR, if there is an AED available, you want to make sure that it is in use. AED is an automatic external defibrillator. This is used if we think that a person has had cardiac arrest and is in a dangerous rhythm. We can take this machine. The very first thing you want to do is turn the machine on, and from that point, that machine will give you instructions on how and where to place the pads, and if in fact a shock needs to be delivered. When you're using a AED, if the person has a hairy chest, you want to take one set of pads and place it in the appropriate place, and then quickly pull the pads off, and therefore creating a place to place the second set of pads in order to deliver the shock if a shock is needed. If you are working with an infant, you may have to place a pad on the front of the infant's chest and on the back of the infant's back in order for the current to run appropriately through the heart. You would use this technique if there are no pediatric pads available. So we're going to talk about fire safety. If you see a fire within the facility, the very first thing you want to do is evacuate the resident. And you can use the acronyms RACE and PASS to help you remember what to do in case of a fire. Always remove or evacuate the patient first when a fire is discovered near them. Then you want to sound the alarm. Then confine the fire. You want to close the doors. And then if you have an extinguisher present, you want to extinguish the fire, starting at the base of the fire. So once again, the acronym is RACE. You want to rescue or evacuate the patient. You want to alarm others by pulling the fire alarm. You want to confine the fire by closing the door. And you want to utilize the extinguisher by starting at the base of the fire and sweeping from side to side. In order to use your extinguisher, you want to pull the pin. You want to aim at the base of the fire, squeeze the handle, and sweep from side to side. The acronym to remember how to use the extinguisher is PASS. And the acronym for using the for fire safety is RACE. The resident should not smoke and wear oxygen. Oxygen is highly flammable. The resident is at risk for injury if they are smoking while wearing their oxygen. If you see a spill, pick it up, put a sign to warn others that it is slippery in that area to prevent future falls. You want to refer to the material safety data sheet before cleaning up a spill. The material safety data sheet will definitely tell you a safe way to clean up the chemical that has spilled. Restraint safety. You want to monitor restraints every 15 minutes. You want to release restraints every 2 hours. And you want to perform range of motion and address the resident's needs while the restraints are released. Restraints require a doctor's order, and once again, it requires meticulous observation. You will have to watch this patient and document every 15 minutes, and you want to make sure that you are checking the restraints and making sure if the restraints are on the wrist that there is enough space between the resident's wrists and the restraints. You want to look at the fingernails and make sure that they are pink and they're getting good circulation. If you were to check on some restraints and you notice that your resident's fingers look cyanotic or blue, you would immediately remove the restraints and you would notify the nurse. So circulation is an issue when we're using restraints, so you always want to make sure that you're checking to make sure that the resident is getting the appropriate circulation while they're being restrained. You also want to remember to release the restraints. And when you're releasing the restraints, this is the time that you're going to address, their needs, if they're hungry, their hygiene needs, unless they occur, you know, obviously before the 2 hours. We're going to address those needs, even if the patient is in restraints. But most definitely, when they are released, you're going to perform range of motion. You're going to address their hydration needs, and you're going to assist them with some of their activities of daily living before returning them to restraints. You must have a doctor's order to place restraints, and you must have a doctor's order um, to remove the restraints. Cyanosis occurs when the skin has a bluish hue You want to notify the nurse immediately if you see cyanosis on your resident in any area of their body. If your resident's heart stopped, if they experience cardiac arrest, if your resident stopped breathing, if they experience respiratory arrest, if your resident has a seizure, if your resident states they want to kill themselves, if your resident falls, as a CNA, in all of these situations, you want to stay with that person or that resident and then you call for help. You stay with them and you call for help. And if your resident is not breathing or have no pulse, you want to start CPR. If your resident is having a seizure, you want to avoid putting your hands in their mouth. You want to protect their head and their airway. Pretty much just preventing them from harming themselves during the seizure. Residents fall trying to reach the call light. Always keep the call light within reach. You want to place the call light on the resident's strong side. You want to remove slippery rugs or throw rugs or other items out of the resident's walking path. Prevent falls. Falls occur frequently during shift change when the staff is distracted. Falls frequently occur in the bathroom. Grand mal seizures involve loss of consciousness and violent muscle contractions. Violent muscle contractions occur with grand mal seizures, and sometimes the residents will urinate on themselves during the seizure. They truly get very, very sleepy. They have a post-sixtal stage after a seizure where they get very sleepy. You want to monitor a resident that's having a seizure. You just want to try to prevent them from harm. You don't want to try and put your hands in their mouth. And you do want to notify the nurse. If your resident has a seizure, remove items out of the way to keep the resident themselves. If a bariatric resident, which weighs greater than 500 pounds, begins to fall, you want to move furniture out the way, and you do not want to attempt to prevent the. When providing care for a resident that is hemorrhaging, which is another word for bleeding, you want to first call for help. Next, you want to put on gloves. Then you want to apply pressure to the area that is bleeding. You want to add layers of bandages as needed until help arrives. If a resident is masturbating in the dining room, for example, you want to calmly redirect the resident to their room, and you want to give the resident privacy. If a resident becomes verbally abusive, de-escalate the situation by speaking calmly while redirecting the resident to become calm. You also want to notify the nurse. If two residents begin to argue, you want to de-escalate the situation by speaking calmly while redirecting the residents to become calm. You want to notify the nurse. If you are bathing your resident and you hear an alarm, stop bathing the resident and make the resident safe. Then go and check the alarm. If you find a resident unconscious, the first thing you need to do is shake or try to arouse the resident. And if you cannot arouse the resident, then you want to call for help or push the code blue. If you find a resident is experiencing shortness of breath, raise the head of the bed to help expand their lungs and to help them breathe easier. You also want to notify the nurse that your resident is experiencing shortness of breath. If you find a resident is vomiting, place them in a sitting or upright position. You want to prevent them from aspirating or from food going into their lungs. Having a shower chair available when giving the resident a shower. If the resident gets dizzy or becomes unsteady, have the resident sit in that shower chair to prevent a fall. Always allow the resident to test the temperature of the water for a bath or shower to prevent any type of burns or skin damage.